Hi all, in this part 3 of contrast bath video, we are going to see about what is the indications and contraindications of the contrast bath as well as the precautions of the contrast bath. In last part 2 and part 1 videos, we saw about what is contrast bath, what are the principles used in it, and how we giving the treatment of contrast bath to the patients. In the indications of contrast bath, we see that it is given for soft tissue injuries like sprains, strains, and like or tendoiculus bursitis or retrocalcaneal bursitis and calcaneal spur like and all. This soft tissue injuries will occur, so we can use that contrast bath to reduce the swelling. And in the joint stiffness and arthritis like RA, OA, for that we can give it for the contrast bath. Then for edema reduction, we give the contrast bath. Lymphatic drainage, it will increase the lymphatic drainage, and as we already saw, the vascular effect will increase the returns to the heart from the calf region. And the post exercise recovery also, we can give it for the contrast bath. In joint stiffness, beneficial for reducing stiffness associated with conditions like osteoarthritis or post-immobilization stiffness. The increased blood flow and alternating temperature help to lubricate joints and improve range of motion. Can also assist with resolving chronic infections affecting the joints. The edema reduction, a primary indication is the manner of subacute edema. The vascular pumping effect assists the lymphatic and venous systems in reabsorbing and clearing fluid accumulation, particularly in the distal limbs. In the post-exercise recovery, increasingly used by athletes for recovery from intense exercise, helping to alleviate delayed onset muscle soreness. Like DOMS, we already know that it it flushes out the lactic acid of the muscles and the other metabolic byproducts. So in the post-exercise recovery, it will give a nice effect. The application of contrast bath in the rehabilitation, like a non-pharmacological approach, will facilitate the healing process and restore the function of the patient. In absolute contraindication, we see that acute inflammation or hemorrhage in that particular area, like recent trauma or any hemorrhages or severe bruising and any hemophilia, we can't give the contrast bath. Open or infected wounds, we can't give. We already said open wounded area, we can't give it. Like lacerations also, we can't give. If there is any active infection like cellulitis, abscess, we can't give the contrast bath therapy to the patients. In PVD, peripheral vascular disease patients, are the patients with the poor circulations like Raynaud's phenomenon positive, severe atherosclerosis, then DVT patients, we can't give to the patients. And also in diabetic neuropathy cases. In pregnancy, especially in the first trimester, while application of the limbs might seem safe, systemic effects or reflex responses in early pregnancy are a concern. Whole body motion is always contraindicated. Consult with the physician must be uh, good for the pregnancy contrast bath therapy. Then the presence of pacemaker or metastasis should be avoided for contrast bath therapy. If there is a fever or lack of skin sensation, we already said that neuropathies, diabetic neuropathy, spinal cord injuries, we should avoid the contrast bath. In precautions, the impaired sensation or circulation should be in the considerable part, and we should monitor the adverse reactions like dizziness, lightheadedness, pallor of the skin, shivering, and any discomforts. In elderly patients, we should give very mild heat because their skin is very thin, and the temperature extreme cold or extreme hot may affect the elderly patient's skin. The pregnant woman's beyond first trimester, we should give some precautionary measures to the contrast bath. The menstruating patients also, we have to do precautionary measures for them. Then the careful temperature control should be there. Then the therapeutic benefits like before and after, the patients will feel very much relieved, like pain is getting reduced, the tissue healing, and uh, it improves the tissue healing. It decreases the muscle spasm and joint stiffness. It is very cost effective modality, and it is very safe and non-invasive. The patient can himself or herself can use this in their home. So this is the contrast bath. Thank you.